we're able to do that is that we are we're contracted with the district, the Champaign-Urbana district, to provide the majority of our services. We're about 10% of their budget. And in the, under the current administration of the district, there's been a recognition on their part that we're a facility or organization with a limited revenue stream, and it isn't appropriate or possible for them to make huge demands on us financially. At the same time, there's some very significant synergies that take place. The district is one of the most creative in the state of Illinois. We're able to participate in that creativity, and the 10% that we bring to the table for them supplements their staff, fills in some of the holes of the Swiss cheese, and together the two organizations make for a much stronger activity. Deb Busey has been very accurate in predicting our revenues in the past, and lately they've been to our favor when the final property tax comes out, and I guess her explanation for that is that there hasn't been all that much activity in the cities, but farmland is increasing rapidly, and it looks like this year farmland is going to increase a lot. The property tax area that we're taking in is around 460,000. The total budget activity is about 850. We depend for the difference on a major state grant, which is the health protection grant of 125,000. We do have our major revenue stream is in the food protection area, food inspections, food establishment inspections, and we do participate in several grant activities at the state and federal level, and that really makes up the difference. The budget includes $45,000 for the dental activity, which we've funded probably for the last 8 years at some level, and it's a hold steady level of about $45,000. And this time we're able to add a bit to our carryover. About $28,000 are being added to our carryover, and it puts us in an enviable position of having a fully funded carryover. And I've always been quite jealous of that carryover. I have not liked it when we've had to dip into it. We are facing some potential attacks on the budget as we design it. Tuberculosis is becoming an increasing threat, and that will cost us significant revenues if we have to get involved in enforcement of the tuberculosis regulations. And we have, of course, tornadoes that hit parts of the county, which have caused us to have additional expenditures. We need to be able to respond to public emergencies without wiping out our financial picture. So again, this is an incremental budget. It looks good, I think, financially all the way around, and I'm happy to present it to you.
Thank you. Are there any questions from Patsy?
Hi, thanks for coming. Could you detail a little bit more for us? It's item 5337. It's on page 2, and it's professional services, and that's projected at $800,000 for 2014 and 2015. It drops down to about $775,000.
That's a result of the 13-month budget in 2014. Yeah. That is the contract with CUPHD for services, and it's a 13-month contract in this year, and it goes back to 12 months next year.
Okay, and so this is the monies that the county health department gives to the public health department, correct?
Correct.
Thank
Yes.
you very much.
The 13 month, I'm not going to, Deb Busey is going to have to comment on 13 months versus 12. Obviously a bit complicated, and I'm sure you're going to hear this over and over again in the week you're reviewing all of this.
Any other questions from the board? John?
I have a question on performance indicators. There's there's a huge jump from the actual 2013 to the projected 2014. On the second line, the number of foodborne and waterborne illness complaints investigated. That's 70 complaints increase. Can you explain that?
All right, let me see where you're at.
It would
here.
be page 3.
Page 3 would be, Deb would be what, 209 in mine?
Oh.
Yeah.
It would be the second and last page you probably have.
Okay, second to last, yeah. Okay, again, show me that line again.
Performance
It
indicators?
would be down to performance, it's the very last column,
All right.
and number 2. I'm just curious why there's a 70 case change there.
Okay. Yeah,
It's projected, not actual, so
this
the
one
question
right
is
here,
what's the
that-
actual?
Okay, the line he's talking about is number of reportable communicable disease. Yeah,
We don't know
30 to
what it
50. Yeah. Well, I'm going to have to surmise on that. I think it's largely an increase in activity related to surveillance on the part of the district, an increase in surveillance, medical and physician and otherwise surveillance of patient activities, outreach. So they're finding more cases. Not that there are more cases, they're finding more cases.
Okay, John. All right. Any other questions on this? Okay, thank you very much.
Thank you all.
Oh, yes, I'm sorry. I have a motion to place the report on file. So moved, John. Second, Stan. All in favor? Aye. Opposed? Motion carries. Thank you.
Thank you all.
Have a good evening. All right, let's move on to Regional Office of Education.
Can I ask Deb just a general question on the 12 verse? Okay, so sometimes it makes no difference in the revenues, like in this case, the 12 versus 13. And as others, can you explain? I know that it has to do with where the revenues come from. Can you explain it once, so I don't have to
Right.
keep asking?
You'll remember from a year ago, you have a 13-month budget, but you cannot generate 13 months of property tax.
Right.
And this budget is largely supported by property tax, so that's why, the revenue doesn't necessarily go up.
Okay.
Some of the grants as well are received once every 12 months, so they don't reflect 13 months of revenue, even though we're paying for 13 months of expenditure.
So only places where it would be sales tax, I should see a
Sales and
decrease,
income tax, you'll see 13 months of
or
revenue.
12. I mean,
Right.
so 2015 would be then lower, because
Right.
it's 12 months. And everything
Correct.
else, I should be able to see the same.
Yes.
Thank you.
Okay, Jane. Board, page 5.
Good evening. I'm Jane Quinlan. I'm Regional Superintendent of Schools for Champaign and Ford counties, and I'd like to thank the county board members and the county administrator for your support of our office. The county's funding for the regional office creates a stable base. It supports 3.55 full-time employees who are responsible for many of the services that the ROE is required by code to provide. I also want to thank Chair Al Kurtz and County Board Member Diane Michaels. They serve on the Joint County Board Education Committee, which meets quarterly. There are 2 members from the Ford County Board and 2 from the Champaign County Board. They oversee the budget from the county as well as providing good input to us on our programs and services. So thank you. The Champaign-Ford Regional Office is one of 44 ROEs in the state of Illinois. We're in the upper third according to population. Our mission is to promote quality education for the citizens of Champaign and Ford counties, to impact public policy, and to support the role of school districts and their employees. The duties and responsibilities of the ROE fall into 5 main categories. We perform the statutory duties, which includes health and life safety inspections of all school buildings and oversight of amendments. We issue building and occupancy permits for any construction on school grounds. We conduct bus driver training that's required for the bus drivers to obtain and maintain their permits. We oversee district compliance with rules and regulations, school recognition and approval. We also conduct hearings for detachments and annexations through the Regional Board of School Trustees and operate the Regional Safe School Program Ready. We administer a variety of grants to provide programs and services to schools. We partner with other organizations to address identified needs. We facilitate cooperative efforts among districts, including an online employment listing and application and human resource assistance, and we distribute the county sales tax for schools' facilities. The ROE is requesting stable funding that is consistent with the budget direction provided by the county administrator. The overall increase in the budget is 2.025%, which includes a 2.5% increase for employees and no increase in commodities or contractuals. Our total request is for $225,484. However, that amount is divided between the two counties based on the proportion of EAV. So the request for Champaign County is $212,533, which is a 1.777% increase over last year. The counties, Champaign and Ford counties, provide 5% of the funding for the ROE. The rest of the funding comes from state, federal, and local sources. The bulleted items on page 5, or on pages 7, highlight some of the changes that are occurring, including a change from a paper pencil GE test to an online GED. The ROE has become a Pearson VUE testing center, and we're offering that online GED testing, as well as we're now able to offer some of the Illinois licensure tests to educators. The other information that I provided is some information about the distribution of the school's facility sales tax in Champaign County, and also some information about the reorganization of the regional offices. Beginning next July, there will be 35 offices rather than 44, and the election for that regional superintendent will take place in November, and then the new offices will begin in July. The Champaign Ford office will not be directly impacted by those changes. So again, we're requesting the stable funding, and I'd be happy to answer any questions that you might have.
Any questions from the board? Chris?
I'm sorry, we went through the percentage increases pretty quickly. What was the percentage increase that you're requesting from Champaign County?
1.777%.
Okay, thank you.
Any other questions? Okay, since there are none, I'd like to have a motion to place on file. Diane, second Max. All in favor? Aye. Opposed? Motion carries.
Okay.
Jane, thank
Thank
you
you.
very much. Let's move on to the extension education.
Okay. Yes, I'm Ginger Bass, County Extension Director for Unit 13 Extension Unit. Like the ROE, we also have two board members that review our budget. We also have an advisory council that is made up of 4 county citizens, and we also have 4 from each of the other 3 counties that we serve. We are a 4-county unit, which is Ford, Iroquois, Champaign, and Vermilion counties. If you want to look at some of the budget highlights that we have actually, about 3 years ago, streamlined our administrative functions to ensure that we actually, hopefully to better serve all of our communities within the 4-county area.
One of the things that we did was we brought educators into the unit. One advantage that we have in the Champaign County unit is that Champaign, or the Unit 13, excuse me, is that we actually have 10 educators in 8 areas, which is the highest in the state, with the exception of Chicago. So we actually have a full complement of educators in this unit, which is somewhat different than the rest of the state. We have been able, those educators used to cover about 23 counties, and they now cover 4. So that has been one advantage that we had. As we streamlined, we were able to have a little bit of carryover, and so that, by combining the units and streamlining some of our administrative functions. We get our funding from several sources. If you look on our sheet, we get about 40% of our funds come from local funds. That is matched at about 85% from the state. The remainder of our budget, which is about $2.1 million right now, comes from a large federal grant, and then some other Smith-Lever funds, which comes with the extension law, and some other state general revenue funds. Our budget this year, we are actually levied based on a referendum, and we're at about, if you notice, that's about 2.1 per EAV, and I think 5% is what our referendum is, so we're definitely under that. Our funding requests have been pretty stable over the last several years, so questions?
Any questions? Patsy?
Yes, I have a number of questions.
Yes, ma'am.
I went on the extension website to get some more budget details, and I couldn't find anything on the extension website. So there is nothing in the papers that we have in our budget book that help me appreciate the amount of funding that supports the various programs that you have listed here under the various indicators. And I do think that would be most helpful if we could see that. And
Yes, ma'am.
I'm curious why it isn't up on the extension website.
What, our full budget?
Well, at least some more details than we're seeing here, and I didn't find any budget up on the website.
Well, I'm not sure. I share my budget with my council, and it's approved. It's approved through the university. I mean, I can certainly share that with you if you want it. Our minutes are definitely up there, so, I mean, that's information that I can provide to you. I provide my annual budget to Mr. Kurtz every year, and we actually go through the budget. We go through the budget with my council every meeting, so.
What Ms. Petrie is looking for is a little bit more transparency on the budget on your website.
Okay, and I'm happy to put some of those things up there.
I don't see that as that being a problem.
No, I don't think so. It's a little difficult to separate. Local funds essentially pay for local offices. About 75% of our funding, of your local funding is going to pay for salaries, okay? And so the match and some of the state and federal monies pay for the educators. But the local fundings is going to pay for rent and for most our local staffing and our local support staff. So it's hard to divide the rest of it up between 4 counties. I am certainly willing and able to show you more than, whatever you need, but
Okay, thank you.
that's what our local funding pays for, and it's really pretty big chunks that it pays for, so.
Thank you. Any other questions? Okay, motion to place on file, please. Stan? Second. Second, John. All in favor? Aye. Opposed? Motion carries. Thank you very much.
Thank you, Mr. Kurtz.
No problem. Okay, RPC, Regional Planning Commission, Head Start, Workforce Development Services, and USDA funds. And now you have a separate book on this one, guys. That's RPC right here. Hi, Cam. Microphone, Cam. There you go.
Is it live?
Pull it towards you.
How about that?
Good.
Okay.
Thank you.
Again, my name is Cameron Moore. I'm the CEO of the Champaign County Regional Planning Commission. With me tonight is Elizabeth Murphy, who is the Chief Operating Officer for the Regional Planning Commission. I think as Chairman Kurtz alluded to, our budget's kind of complex, so it takes two of us to try to explain it, I guess. But so happy to be here tonight. What I'd like to do is kind of do this maybe in three stages. Like to take a few minutes and give you just an overview of the RPC budget. And then Betty's going to talk specifically about impacts on county finances. And then thirdly, we'd be happy to answer any questions that you may have. So let me just kind of roll into that. As you all know, we did a change of fiscal year, and so we are back, the budget we present tonight, back to a 12-month fiscal year instead of 13 months. I think a couple of things to note about the complexity of our budget. Our budget does accommodate over 100 active departments and 9 major program areas. I think everybody's aware of our reliance on state and federal grants. We're projecting that that will account for about 87% of our revenue and expenses in 2015. Salary and fringe benefits represent about 65% of our total operating expenses. We do think that our staffing levels they vary, if not weekly, certainly by the month, but that we'll maintain a staffing level of somewhere around 225 full-time employees. One of the things I think you're all aware of, because of our heavy reliance on state and federal funds and the uncertainty that exists at both the state and federal level, that's a little bit challenging for us, and so we have to deal with those uncertainties, and sometimes they're good to us, and sometimes they aren't. Recent years, on balance, they've been relatively good, but we don't know exactly what may happen over the next 12 months. This is our best guess in terms of the budget. I did want to just take a few minutes and talk about our major funds, our operating fund, which is Fund 075. It does contain this year some increases in revenue, either for new programs or expansion of existing programs, and just to briefly highlight those. Many of you are probably familiar with the Summer Youth Employment Program, which is actually a partnership between Unit 4, the City of Champaign. This year, for the first time, I think this was the third year of the program, but all of those participants actually ran through RPC payroll, so for 6 weeks in the summer, our employment swelled by 140 or 150. We also have some new funding this year for a USDA Rural Community Development Initiative. This will actually be providing education to local elected officials in a multi-county area. We've also seen some expanded funding for emergency shelters for families. You also are probably aware that about a year ago, there was a major expansion in our court diversion program, and one of the manifestations of that is the Youth Assessment Center, which we man extended hours over what we used to be able to operate that program on. And then also some increase in funding for LIHEAP, the Low Income Home Energy Assistance Program. So in that operating fund, we're projecting 12-month revenue and expenditures of about $13.5 million. One of the things that we do continue to do with our operating fund, we don't have a lot of flexibility in our budget, but we do pay attention to our fund balance, and so we do continue to try to find ways to grow our fund balance to an appropriate level for an agency of our size. Also want to talk briefly about the Early Childhood Fund, probably known more to most of you as Early Head Start and Head Start. We anticipate, and I'm going to correct myself here in a minute, but we do anticipate that that fund probably will be relatively stable this year, about $7.6 million in revenue and expenses. Now, there is one caveat to that. We recently, the deadline for this application was August 20th. We recently submitted an application And I'm not even sure what to call it. It's not really an expansion of Early Head Start, but under the budget deal that was made back in January, there was about $500 million available nationwide for, let's call it a new kind of Early Head Start delivery system. About $16 million available here in Illinois. I don't know exactly how many agencies applied for this money. We did submit an application for about $1.2 million in total. And let me just briefly tell you what's different about that than our current delivery system. This particular $500 million is really not intended to provide services to kids who are not currently getting services. So it doesn't really address kind of the wait list issue, which I'm sure everybody has to deal with. The idea behind this program was to improve the quality of services for children that already had access to daycare. So the delivery model for this particular funding is, if we were to receive the funding, we would actually be placing staff in community-based daycare or home-based daycare settings to provide Early Head Start services to children who are already in those settings. So again, it doesn't necessarily reduce the wait list or get a lot more kids access to services. The intent behind that was actually to improve the quality of services for children that already have some type of daycare. I'm not terribly optimistic that we'll get funded with that, but it could happen, and so I wanted you to be aware of that. We really didn't include it in our budget because, again, my guess is it's certainly less than a 50-50 chance that we'll get funded, but you never know. We have such a good reputation with Head Start, that may work in our favor.
Cameron?
Yeah.
As part of that 500,000, that was the sequester, that money that was reinstituted by the Congress. I received an email about 5 hours ago from Kathleen, and I have information from our regional office that they have issued the award notice approving request for the COLA and return of the sequestered funds. I don't know if they're sending a copy, hard copy. Would that have included, might include this additional funds, the one that they're talking about here? Would you know?
Well, it wouldn't have anything to do with the funds I just talked about.
Okay.
But I'm sure you're all well aware that we took about a 5% reduction in Head Start funding under what became famously known, I guess, as sequester. As part of this budget deal that was reached in January, we were notified we were going to get that money back. We're just in the process, finally, of getting those funds back. So I think right now, if we don't have all of the staff positions filled, we're certainly in the interview process, and they may be filled as of today. So that's kind of a different set of money, but we did get back every penny that we lost under sequester. Also want to talk briefly about the Workforce Development Fund. I think you're all aware that 2 years ago, we became the grant recipient fiscal agent for the Federal Workforce Development Fund, serving a 4-county area. We are budgeting that for next year, revenue and expenses of about $3 million. One thing I do want to comment on this, which is not directly budget related, but may be next year. This funding has been available for a number of years now, 15, maybe 20, under something called the Workforce Investment Act. That was the federal legislation that authorized this funding and, to a degree, told you how you could spend it. There is a new legislation. The Workforce Investment Act will be no more as of June 30th of 2015. There was a replacement legislation which was passed in the House and Senate, also signed by President Obama, actually in July of this year, called the Workforce Innovation and Opportunity Act. That particular piece of legislation does not go into effect until July 1st of 2015. We know it will change how we do business. We're not completely sure we understand all those changes, and I'm guessing that the feds do not either, which is why this doesn't go into effect until next year. That will give them some time to write the rules and determine what you can and can't do with the money. Having looked at the legislation, I guess just briefly, it seems as if there is more emphasis in this legislation on the job experience, and maybe a little bit less in terms of just training people, but actually getting them experience in the job setting. And it also appeared from what I read that is some emphasis placed on youth employment programs, and particularly summer youth employment programs. And so that may link with the program I talked about previously. But again, I'm guessing it will be sometime after the first of the year before we really know exactly how that will change the way we'll deliver workforce services in a four-county area.
Diane?
Real quick, that would be in place of or to enhance?
It's in place of.
Okay.
Yes. Also want to talk briefly about our Economic Development Fund. This is where all of our loan programs are. You know, frankly, I think if you talk to anybody in the lending business, including us, the last 4 or 5 years haven't been great. We certainly saw a precipitous decline in the demand for loans, and we also saw a significant decline in the quality of loans. Starting to see the demand come back a little bit, but in 2015, we're anticipating about $250,000 in loans, well below what we would have done maybe 5 or 6 years ago. But again, there aren't that many people out there looking for money. I think as the economy gets better, more and more people will be out there, but that's just kind of the nature of that. We do anticipate, right now, our loans receivable in that fund are estimated at about $6.2 million. To give you an idea of how much, about $4.2 million, excuse me, to give you an idea how much that's changed. 6 or 7 years ago, the loans receivable were probably over $6 million. And we just are not making that many loans in recent years. So last one I want to talk about is the USDA Economic Development Fund. Same type of thing. This is funding that we got from the USDA to make loans in rural areas. We cannot use this money actually to make loans in communities over 25,000. This funding is available. We can loan it anywhere in a 6-county region. Again, it's been a slow start. We got this approved right about the time the economy tanked. And we just, I believe we've made 2 or possibly 3 loans out of this fund at this point. So we're starting to see a little bit of demand for that particular loan fund pick up a little bit. But again, it's kind of been slow going. So I want to talk briefly just about our overall budget. For 2015, we're anticipating that our administrative expenses will run about 8% of the operating budget. That's up a little bit from where we've been in recent years. We've been in the 7 and 7.5% range. But that's well below the maximums that are established by our funding sources. On federal grants, the maximum amount of money we could use for administration is 15%. Again, we'll be at about 8%. On state grants, the maximum you can use is 20%. So we'll still be, you know, well below those thresholds. And frankly, this is something that we pay a lot of attention to because it affects our ability to compete for future grants. One other thing I want to mention, which I know you're all aware of, but you know, we do anticipate fringe benefit costs going up, largely driven by health insurance, and I know you're dealing with that as well. So really, we look at 15 as steady, possibly a little bit of increase in funding, but nothing significant unless we would be fortunate enough to get the early Head Start funding. With that, I'd like to turn it over to Betty, and she can talk specifically about impacts on county budget. So,
Thank you. If you could go to Roman numeral 8, I'd like to walk through the specific Champaign County impacts of the RPC budget. The first one being the Champaign County Planning Contract for Professional Services. I believe the board reviewed and approved that last week. That's been budgeted at $74,827, which represents a 2% increase effective January 1, and this supports the county board directed long-term planning functions. Champaign County's portion of the RPC membership fees is budgeted at $20,000. Roman numeral 8. Membership is $20,998, which represents a 3.2% increase, and the membership due structure for all of the RPC member agencies is based on a per capita and a base fee, and it utilizes 2010 census data, so it's based on population.
Rachel, we have a
Can you
question.
tell me, the 2% is the numbers are 2%, but it's a 12-month contract as opposed to 13. So can you tell me factoring that in, what's the actual increase? I mean, I understand it's 2% on the total,
About
but
$3,000, $2,500 to $3,000.
I
So-
believe your fiscal 14 number is annualized to 12 months, isn't it?
yeah, so the question is it really 2% or is it more?
We'll have to go back and look at it.
Okay, thank you.
The senior services matching funds for that program are budgeted at $22,807, which represents a 1.5% increase. And these support over $100,000 in additional federal and local support for enhanced senior services, which includes case management. Champaign County support for QWADS is through the Highway Department. That totals $30,427 and represents a projected 5% increase. These matching funds support over $700,000 in federal and state funding for transportation engineering, planning, and research functions. Champaign County support for the court diversion project is budgeted from the public safety tax at $230,747 for the new youth assessment center, which now includes early intervention assessment for at-risk youth, and we've also got expanded evening and weekend hours. The Mental Health Board provides an additional $26,000 to support the Youth Assessment Center, and all of these local funds support an additional $350,000 in juvenile justice diversion funding from the federal and state government. The police training grant is budgeted at $8,086 through the Sheriff's Department budget, and that's a 5% increase, and that money is used to leverage over $400,000 in state funding for law enforcement. And with that, we'll take questions.
Any questions from the board? Rachel?
It's more a comment than a question. Not to mean that there is less important to the Youth Assessment Center, but if you've looked at the public safety sales tax revenues, they're expected to be going down. I mean, it's more a comment to the board than to you, because you're just saying this is what we are requesting. So I'm not really sure where to cut it, but to increase this by 40%, we also need to increase the budget to fund the drug courts, which is also important. I mean, they're all important, so I'm not trying to say any one of them is less important than the other. I'm just saying we are going to have to make some difficult choices because we have less revenues coming in, and they have to be divided.
Deb?
If I could respond to part of that. First of all, public safety sales tax, this program apparently is new because the budget for this year is over $200,000. So I don't know if it's being spent on another program, but that is just how much of it is going towards this program. And the fiscal 15 number is based on anticipated 5% of what we expect to collect this year. This always lags 1 year behind, so when we're budgeting for it, it is fairly stable. And when you look at the sales taxes, you have to remember that both fiscal year 13 and fiscal year 14 reflect 13 months of revenue. And fiscal year 15, we're going back to 12 months. That's because in fiscal year 13, we extended the closing of the fiscal year by an additional 30 days. So we actually had 13 months of revenue in fiscal 13, even though it was a 12-month fiscal year. We have 13 months in fiscal 14, and we only have 12 months in fiscal 15. So the taxes are not going down. They're fairly stable or slightly increasing.
No, I'm not saying that per month is not going down, but if I'm looking at the public safety sales tax, we anticipate, because it's 12 months versus 13, I get it. But still, the total is projected for 14 is 4.7 million, and for budget 2015 is 4.5 million. So I understand that it's because per month it's not going down, but still the total we have to work with on the 12 months versus 13 months is lower. And so when they're asking for more money, I mean, we still have only 4.5 million to divide up, that's all.
And I just want to make sure that everyone understands that the 5% for delinquency prevention funding is based on 5% of 12 months each fiscal year. We've never increased that amount for 13 months. Okay?
Okay, but we still don't have 40% increase available to play with. Well, that's what I'm saying. So that's why I said, it's a comment for the board that we're going to have to make some very tough allocation decisions, because neither one of them is any less important. The other question is maybe for the mental health board, why are they flat? And again, it's not really a question to you, but why are their support not going up a little bit?
Well, I think that had to do with the expansion of the court diversion services and the establishment of the Youth Assessment Center. We needed to have more money to pay for the staff to cover the additional hours.
Well, the question is, why is mental health board not subsidizing the court diversion any more than they did the previous year where everything else is going up? I mean, I know it's not a lot of money. We're talking 26,000 total, so even 2% of that is not going to be significant. Just doesn't look good.
Well, again, it's a funding request we made, and it's
Right.
been honored, so we're assuming that that'll happen again.
James?
This may be more a question for Deb. I'm looking at the staffing history. In previous years, I don't recall this, when GIS was part of RPC, was their headcount kept separate? Or does this represent numbers with that GIS headcount pulled out? 7. Staffing history, 2012 through 2015, going from 57 employees to 67 employees over 4 years.
And that's just for the RPC fund, and the GIS consortium was separate.
Okay, so it had its own counter, okay. Thank you.
Any other questions? Chris?
Yeah, a couple. With regard to the Youth Assessment Center, I noticed the contribution from the City of Champaign and City of Urbana vary significantly from year to year. How is that determined? I mean, I noticed Urbana's contribution dropped off substantially in this budget.
Yeah, I wish I could tell you how they determine which amount they provide. We certainly provide them with a budget and a request. How they make that decision or determine how much that they will contribute, obviously, is an internal budget process. So I don't know exactly how they come up with that number.
But we would appreciate it if you paid us and then they pay what they feel like paying, essentially.
Well, we feel like they've made a commitment to it, but we also understand that based on their fiscal condition, that amount could change from year to year. I would not expect, without, a reasonable amount of notice, that it would change dramatically, because we do have obligations we've made on behalf of the Youth Assessment Center. For instance, we just renewed our lease for another year. So I would hope if someone decided that they could not continue to fund that they would let us know in an appropriate time frame so that we could figure out how to not honor the commitments we've made.
Okay, thank you. Yeah, I just noticed there was what appeared to be a significant drop from previous levels. My other question was, I'm going to follow up on Mr. Quisenberry's question. It's a significant headcount increase over 4 or 5 years. Do you know where the bulk of those, can you tell me where the bulk of those positions are in the RPC organization? Was it part of the workforce development initiative primarily, or where did those come from?
It's really almost across the organization. The addition of the workforce development programs actually brought with us maybe 12 or 13 staff positions, so that wasn't a huge increase. We've had the opportunity a few years ago to expand Head Start, and that resulted in a reasonably significant, if I recall at the time, maybe 20, 25 staff.
But we're talking about the on page 7, staffing history, which the 2015 number is 67. So that obviously doesn't include Head Start teachers.
Let's talk about all these positions.
Yeah, well, again, it's pretty much across the board. We've seen increases in our case management staff, some administrative staff on the fiscal side. As we begin to manage more money, we need more folks to do that. We've seen some increases in the transportation planning staff, in particular, transportation planning and engineering. So it's really pretty much been somewhat evenly dispersed across RPC.
Okay, thank you.
Jim?
I guess to go back to the Youth assessment program, which I think is a great program and needs support. I'm a little concerned because it seems like we're increasing our funding if the cities are starting to decrease their funding when a lot of the program, a lot of the kids are coming from Champaign-Urbana. I see that as problematic. The other thing, I had a question about transportation and the 2040 study, which we discussed after the Olympia Drive opening. And I want to see that transportation, the Highway Committee, have some more input, because the discussion that we had that day, I want to see that some more of that is brought to you, like that we discussed, because I don't think the discussion that we had that day seemed to be brought to you as it was that day from the comments that we made during that meeting when we talked that day. So I want to make sure that we have that input.
Yeah, well, without some specifics, I guess I don't know, but I did, and as I typically do, I did get a briefing from our staff after they met with the County Highway Committee regarding the meeting, the feedback that they received, and also how that feedback either coincides or conflicts with other feedback. The particular project that they're working on, where they came to present that to the committee that night, the long-range transportation plan, that is a multi-jurisdictional plan. So we take feedback from everybody and try to synthesize that into a plan that everyone can support.
Any other questions? James?
Yeah, I've been scanning through some of the employment histories, and I'm curious, in some places we have a 5-year model trend for employment. In some cases, like early childhood, we only have the last 3 years. I think it would be helpful to be more consistent and always, more is better, I guess.
Anything else? James? Anyone else? All right, a motion to place on file RPC. So move Stan, second. Geraldo, all in favor? Aye. Opposed? Motion.
Great, thank you.
Good evening, everybody. I want to introduce a couple people that are with me. I'm Peter Tracy with the Champaign County Mental Health Board and Developmental Disability Board. We have with me Dr. Dolores Henry, who's the president of the Mental Health Board, and she's, as most of you know, she's an educator and has a lot of interest in the youth programs, and so a lot of the coordination of youth activities, she's been incredibly helpful. I also want to introduce Sue Suter, who is the president of the Developmental Disabilities Board. And for those of you who don't know Sue, just to give you a little background on her history, she is the former director of the Illinois Department of Public Aid, which is the state Medicaid agency. It's now HFS. And she was also the director of the Illinois Department of Children and Family Services prior to going to Washington. So we're very fortunate to have Sue as the leader of our board. I also have Tracy Parsons is here with, who is the project director for the Access Initiative. I was going to just start with a little bit about developmental disabilities, the Developmental Disabilities Board, because the other three that I'm going to talk about all sort of fit together, so we'll deal with DD issues first. First off, developmental disabilities, when you look at the combined money from the Mental Health Board and the Developmental Disabilities Board, it is the disability area that we put the most money in. That's frankly because of the statutory requirements. One of the things that we're working on this year is an expansion of what we call SILA, which is Community Integrated Living Arrangements, essentially houses where people with disabilities live. And the reason that we did an RFP is because we have a significant number of people, roughly 20 people that that are from Champaign County, that have awards from the state to pay for SILA placements, and there are no SILA placements in the county available for those people. So the proposal that we have, the RFP, we intend to buy 4 houses. It'll cost us $50,000 a year for each board for a 10-year period. That will give us somewhere between 12 and 16 SILA slots for people to live here in the county. And we see this as an ongoing issue, and part of what we're hoping for are some solutions, bringing in some new providers so that we can address this issue, because we strongly feel that anybody who is from Champaign County ought to be be able to live in Champaign County. The other things that we've been working on have been related to aligning our funding to match up with the changes that are occurring nationally. The interesting thing about intellectual disabilities and developmental disabilities are that there are significant changes in statute, in court decisions, as well as in rules from Medicaid, CMS, the Center for Medicaid and Medicare Services. You've probably seen that in Illinois we passed an Employment First law. This relates to people with disabilities working in competitive situations and not being paid substandard wages. It also has to do with the issues related to segregating people with disabilities into centers. We are essentially, there are 3 states that have discontinued the use of sheltered workshops. And the primary issue there is the segregation as well as the substandard wage. And as far as I can see at this point, the handwriting is on the wall. Any sheltered workshop that exists here in Illinois is probably going to be phased out over the next 5 years. The other things are the Ligas consent decree and Olmstead, which was a decision a few years back, which has really changed the way the SILA houses look. Many of the people that needed residential in Illinois were placed in what we called ICFDDs, or intermediate care facilities for people with developmental disabilities, and those were for 16 people or more. Those are being phased out, the Ligas consent decree, and so that is the reason that our RFP looked for houses, SILA houses with 4 people or under, because that is essentially the standard that the consent decree calls for. The other things that we're talking about doing, or we're looking at, basically the major issue in developmental disabilities and intellectual disabilities has to do with integration, having them be part of the community basically every phase of their life. And so the funding that you see when you look at the contributions and grants is really focused on that at this point, and we're moving in that direction. Another major area that we're focusing on is the issue of person-centered planning. So those are again federal requirements in the new CMS rule, and we're looking at having our money essentially support person-centered planning and use the money to support people in that regard. We have also worked to eliminate any possibility of supplementation of Medicaid rates, which is a huge issue. Basically, with Medicaid, when an agency accepts a payment for a service through Medicaid, it is an all-inclusive rate. You cannot add to it. And so we've been working on addressing that issue because we were co-funding some state programs and it got a little messy. The other areas that we are working on with the developmental disabilities has to do with improving fiscal accountability. We're implementing a web-based billing system that we're piloting this year. We're also doing that on the mental health board side. And then the last area I want to touch on, and this also relates to mental health board as well as the developmental disability board, and that is the area of cultural competence and the cultural issues that people have. We want to make sure that we use what an agency does related to cultural competence as a major consideration for who we fund and what we fund. So that'll be a little bit different this year because the agencies in our community have had a chance to address that. To give you an idea of what that has to do with on developmental disabilities, as an example, autism You've probably read in the papers that many more kids are being identified with autism. In kids that are African American are typically identified 4 to 5 years later than white kids. So again, that's a huge problem, because the earlier you identify the kids, the more chance that you have of addressing the issue. So that's the Developmental Disability Board. At this point, I'm going to move into the Mental Health Board, if that's okay, or unless you want to ask questions now.
Any questions up to this now? Okay, go ahead, Peter.
Okay. I also brought this is, before we move off of this, I brought a memo that we issued about all the change issues that are happening with developmental disabilities, and I thought I'd share it with you. I didn't go over it, but take a look at it when you have a chance. Also, feel free to call me if you have any questions about it, because it's, as I said, change is really, a lot of things are happening that are changing the way the system looks. Now, the interesting thing on the mental health side and the developmental and also the substance use disorder side is that we're also seeing a lot of changes, but they're not driven by the same factors. On the mental health side, the changes are being driven by changes in the funding structure from the state and the way Medicaid is changing. And the biggest change that we're seeing on the mental health side is managed care. Managed care is coming in Champaign County. We have five managed care entities that address that mental health and substance use disorders are included in all of those areas. It is incredibly confusing, and I would be happy to answer some questions on that, but it's almost like an hour discussion to get to it. But needless to say, the face of what mental health services and substance use services look like in Champaign County are going to change radically, as is the rest of the state. And it's primarily because the agencies that have been the recipients of state funding no longer are the only game in town. The managed care companies can select other providers, and so that we could see new providers coming in, and it could change the look of everything in this community. The other thing that I wanted to mention on the mental health side is that I wanted to remind you that the Mental Health Board still has a responsibility for developmental disabilities and intellectual disabilities. We earmark $597,000 of Mental Health Board money to support developmental disability services. We have and we try to work between the two boards to make sure that we have integrated planning and that the way we use the money is provides the largest bang for the buck and benefit for people in Champaign County. The Mental Health Board is also a partner in the SILA expansion RFP that I mentioned, and they will be putting $50,000 a year in for 10 years, and that will serve somewhere between 12 and 16 people when we get that fully operational. The other, I think I said change is happening everywhere. The other major change is the Access Initiative, which the Mental Health Board supports through direct funding, and the match is pretty much all from the Mental Health Board. That project, the cooperative agreement ends September 30 of 2015. So during the next year, we will see the project end. And so we're in the process of working on the sustainability plan and how we're going to transition to a post-Access Initiative period. It was interesting that you were asking the questions about the Juvenile Assessment Center, because one of the things that Tracy Parsons does in his role as project director is he is now chairing the Community Coalition, which is essentially our systems level entity that includes many community leaders from education. The state's attorney is on that. The cities of Champaign and Urbana are included in that. And the assessment center is something that we see as the responsibility of the entire community. Obviously, we use the quarter cent, the 5% money, 5% of the quarter cent money that we get and that we manage all goes actually to support the assessment center, at the Juvenile Assessment Center at this point. In addition, I can tell you that the city of Champaign is ponying up money to support the Community Coalition that has been established and also is putting money into the assessment center. We have the school system has donated the property at least for one more year where we're located. So I believe that the Community Coalition will be working on the problem of how to sustain the assessment center, because we do think that's an important program, and it serves to address the needs of all the kids that are involved with not only the juvenile justice system, but the kids that are status offenders as well. I mentioned the quarter cent administration team. Well, we'll be talking about that later, but one of the things that we also do through the quarter cent money is coordinate with mental health board money that funds various types of services. You've heard me talk before about the Parenting with Love and Limits program. That is overseen also by the quarter cent administration team, which includes people from court services, state's attorney, as well as mental health board and other providers. The other thing that we have been working on in the past year, and we talked about last year, is the issue of the the mental health and the criminal justice issues, the adults that have mental health issues that are involved with the jail. We have reallocated significant amounts of money to the mental health. I'm sorry, I still call them the mental health center. Community Elements is the primary provider, who have worked closely with the sheriff and with Alan Jones to put together a plan that is designed to make sure that anybody that has a mental health issue that gets in the jail is linked to services when they leave, and to the extent possible, we deflect them from coming in before they get there. And obviously, there's more work to do. I had some conversations with, actually email conversations with Patsy Petrie about this, and we've looked at other, I think one thing that we need is some sort of a residential option that is available for people to go to as opposed to going to jail. Many of these folks are homeless. Some of them have substance use issues. So a sobering center or a sort of a respite. And at this point, Community Elements is looking at allocating a portion of Time Center to serve that function. We are also continuing to be involved with local collaborations. We co-fund the 211 system with United Way. We also we're also monitoring and doing what we can with regard to watching what's happening with the state. At this point, if the state income tax is not extended, we think that the mental health and substance use disorder programs are going to get hit very hard. We are hopeful that that doesn't happen, but we don't, obviously no one knows for sure what's going to happen with that. And as I mentioned, we are doing the web-based system and using cultural competence as a decision factor with allocation. Moving on now to the delinquency prevention grants. As I said, 100% of the funding that we have, that we manage, that is your money, goes directly to the Juvenile Assessment Center. No other provider gets any of that money. And just in case you didn't remember this, we do not take any kind of an administrative cut for managing the money. One of the things that I think that the team that we work with, we put together a team that makes those decisions. It's not just the mental health board that makes the decisions, but we have the, Tracy Parsons from Access Initiative and Julia Reitz from the state's attorney's office and court services and the detention center are all involved in how those decisions are made. And so it has helped us coordinate services for youth nicely. We also have the other thing I would mention is that part of what the administrative team is also doing is they're part of the planning process for the Access Initiative Sustainability Plan. Lastly, we'll get to Access Initiative, and we are, as I mentioned, this is September 30th. The federal and state money from the cooperative agreement go away. We are in the process of scaling it back at this point. There's less money in the budget than there has been in previous years. We are focused on completing the evaluation, which is a requirement of the cooperative agreement, as well as looking at how we're going to close out the grant as we move toward the end of this process. The other things that we want to make sure, in addition to the sustainability issues, as I mentioned, we have the systems level. We're looking at continuation of the youth and the family organizations that have been created. We are also looking at continuing the infusion of the trauma and justice-informed services and supports that have been really a highlight of what Access has done. We've also moved to prioritize Access Initiative youth to be accepted in PLL, so their referrals will be prioritized in the Parenting with Love and Limits program. Lastly, another major issue, I mentioned we have 5 managed care companies. One of them is a company called Choices, which is focused on youth that have mental health issues that are also multi-system involved. And the Choices pilot project operates in 4 counties in Illinois, and one of the things that Access Initiative has done has been to link up with Choices and to, as a matter of fact, many of the staff, as we've reduced the size of the staff that have been providing direct services, many of those people have gone to work for Choices. So it's been an opportune time that Choices has actually come in, because the philosophy is exactly the same as the Access Initiative. So anyway, that's sort of an overview. You have the numbers in front of you, and I'll be happy to take any questions that you might have at this point.
Questions, Patsy?
Hi, Peter. I have 2. The first one is I notice that there is monies in the mental health budget and in the Access budget for conferences and training, but there's none in the developmental disabilities budget. Is there a reason for that?
Yes, I think the reason is that any conferences and training related to developmental disabilities would be funded through the Mental Health Board. They pay an administrative percentage. That's part of the agreement between the 2 boards. Okay. So we essentially transfer money from the Developmental Disabilities Board to cover administration, which would include the training and any kind of conferences.
All right. And my second question has to do with the new housing, the Scylla housing. And I certainly support facilitating residents of Champaign County for that housing as it progresses, and the boards are able to buy buildings. Has something been set up either by the Developmental Disabilities Board or by the statute that's established this, that gives criteria to make certain that it's people in Champaign County that are serviced and not people who conveniently come into Champaign County to take advantage of this housing?
Well, right now, it's clear in the RFP that the only way that we will only fund people that either have family here or originate from here. The only exception is what is called the ACC team, and I've actually forgotten what that stands for, but it's essentially a group that operates with the governor's office that is focused on moving people from the state-operated developmental centers back to the community. And we said that if you had a situation where moving someone from a state-operated facility actually facilitated the people from Champaign County being in the home, that would be acceptable. And the reason that we looked at that and decided to have that provision added to the RFP is that the money that follows the people coming out of the state-operated developmental centers is more and guaranteed at a higher level. So it's almost like having a person from a state-operated developmental center coming into a home could be the anchor point for making sure that the facility would be financially viable. So we don't know how that's going to play out, but all of the applications that we had are from ACT providers. They've signed the pledge, and at this point, I think that they're looking at, I haven't heard about anybody from a state-operated facility that might come, but it would only be if it benefited people from Champaign County.
Jim?
Maybe this is just a clarification for myself, but in discussions for the reentry program, there, and your comment about Patsy's question about sobering centers, does the Time Center have a respite center or portion of it now for those that are, may have some mental issues or problems right now? Because I think that was brought up in the last discussion, or last meeting we had for the reentry program, where if they wanted to put themselves into that program, they could.
Yes, that is correct. They do have a respite program, but unfortunately, the way Time Center is set up, I think that there's some significant limitations. And actually, the Mental Health Board provided funding for them to hire an architect to look at changing the Time Center structure, and I think it's feasible to do this so that you would have kind of a totally separate program for the respite and also for the people that could be deflected from the jail.
Diane?
Just a question, with this going away in the middle of next year, or they're close to the end or whatever, I'm looking at the numbers here on page 27, and I see that you've dropped two of the providers, basically. Well, not dropped them, but they're not slated to be budgeted for. Went from 5 to 3 providers. But then also I see where the total appropriations for programs went from 1.2 million to 500,000. However, you still have the same number of clients for the programs. So that means, if I'm thinking correctly, that means that the 125 we're getting benefit around of 9,700, and now it'll be $400 per client. So what am I missing? I mean, what are we dropping? What are we losing? And why weren't we able to do that before and maybe add more clients to this?
Tracy said it's because of choices, but I think it also is that our contracts here run from July 1 to June 30th.
Sure.
So the plan at this point is to, so if you look at what's in the 14 money, the funding level is higher for the first, all the way through December, so of this year, which would be the first 6 months of the contract year. And then most of this additional 500,000 will be programmed to finish off the year. So we don't plan to continue the contracts after June 30th of 15.
So this 2015 budgeted amount only goes through June 30?
Yes.
So you're saying that's a 6-month budgeted projection?
Yes, I guess it is.
Okay.
Even though the program will run to, the other aspects of the program will continue, and I would think that, we're working on a sustainability plan now, but I would think that we would be able to kind of backfill whatever program, whatever portions of the program we want to keep with some of the mental health board money that we currently put in. Like right now, if you look at money for direct services, not counting Parenting with Love and Limits, it's about 535,000 that that could be reprogrammed.
Okay. And
Go ahead, Dan.
And then my next question, and once again, just to clarify in my brain, on page 25, on your expenditure item on the contributions and grants, once again, the projected amount was 835,000 for 14 and 718,000, which isn't that far off. But is this 2015 budget also a 6-month, or is that a 12-month item? Because that seemed to be about the same amount of money for grants and programs, but it didn't quite match up with this page here.
Yeah, that would be to finish out the September 30th. That would pay for salaries and other expenses that aren't necessarily direct service connected.
Okay, so in this grant and contribution was also salaries? Is that what you're saying?
Oh, I'm sorry. No,
Line item number
yeah, I'm looking.
53392.
I see it, yeah.
That's, I was kind of trying to match it up a little bit with the next page.
I'm not sure if that relates to money that's carried over from the previous year. I would have to check on that and get back to you.
Okay, thank you.
Any other questions? Chris?
Just had a couple. In the narrative, it mentions funding from the Mental Health Board. That's the HHS grant, right? It's not mental health board property tax dollars, it's the grant. It's from the Mental Health Board because the grant is to the Mental Health Board?
Well, there's a combination. All the money that comes through the grant or the cooperative agreement goes through the Mental Health Board, and we contract most of it out, although the administrative part, like the project director's salary and support is also included. But we also then have other contracts that are funded directly by the Mental Health Board. As I said, we have $535,000 worth of contracts that directly support access, plus we have the Parenting with Love and Limits, which is roughly $800,000. That, as I mentioned, we prioritize Access Kids for that program at this point. So,
Okay,
you
yeah,
know, it's a mix.
I was having trouble with the narrative. I think that explains it. I was seeing with a mention of $1.2 million in funding from the Mental Health Board, and it wasn't clear to me how you got to that amount, how you got to that
The
number.
1.2 is the combination of Parenting with Love and Limits and that other 535,000. There's actually, to be honest, I think that's really direct service. We also have what I have described as wraparound support contracts. A number of contracts the other contracts we have prioritize Access Kids and families first, and if there is a kid, it also requires them to participate in wraparound child and family team meetings, and so there's quite a bit of match that's involved with supporting access at this point.
Okay, yeah, I was confused by the language, will be continued during fiscal year 15 to support Access Initiative contracts. I mean, it sounds like the two programs you've described aren't really Access Initiative contracts, right? They may be contracts that
Okay,
supplement the
what
activities
page are you
of
on?
Access.
'Cause I'm not-
Page 24 in our packet, it's the first page under Access Initiative grant. It's the
Funding
budget-
from the Mental
budget-
Health Board?
Budget highlights, yes, sir.
Well, I think what I mean is that the $1.2 million that we currently use to support access, when the grant ends, we will continue to use the money to, as part of the sustainability of what we've done with access.
Yeah, it's not anywhere near what it actually says, though, so maybe we want to work on that. Maybe we want to work on that narrative.
Okay, well, that's what it means. And
Okay, so, so on this page, like,
basically, what it means is that we're not going to, just drop everything as soon as the grant ends. We're going to continue the commitments that we've made.
okay, lower, on the first line of the financial, with just below that, the financials 331-94, that HHS, Mental Health Services for Children line, 884,000. That's the proceeds from the federal grant, right?
Yes,
Okay, the 1.2 million that you refer to in the narrative is in addition to that?
yes,
Okay, and that consists of, Parenting with Love and Limits support, and what was the 535 for?
a variety of different contracts. Most of them are, some of them are with Don Moyer to pay for the what we call the wrap home. We
Sure,
basically
sure.
fund.
But does I'm having trouble understanding how how that relates to the Access Initiative. I mean, those are independent programs, right? That can continue after the Access Initiative is gone.
Well, I didn't say that. What I said was that
Well,
the money is going to be
It is
reprogrammed.
possible for them to, what I'm saying is it's possible for them to continue. They're not tied to the Access Initiative in any way. You could decide to continue those programs or not, or partially, or new programs using that
Yes,
1.2
that's,
million, right?
that's correct.
Okay,
But the thing is, the way we're using the money now is based on the fact we have the federal money that is coming in. With that gone, we have to rethink how we use our money most
okay,
appropriately.
I think I understand what you're getting at. It just, the issue I guess I had is the word support. When I see support X initiative contracts, support to me means pay for. In your case, in this narrative of support, I guess is intended to mean complement.
But it does also pay for, it's real money. I mean, it is.
Well, but it's not money it's not money that shows up on this
Oh, yes, no,
on
it
this
is not money,
sheet.
it is not money on.
It doesn't go through the Access Initiative budget. It's a separate fund,
That's
a
correct.
separate budget.
The Access Initiative budget is really just the money we get from the grant.
Okay, thank you. That, again, I understand, now that you've explained it, I understand what you're doing. I just think the narrative is bad, and Deb will fix it.
I'll fix it.
My other issue, I guess, was minor. On this Access Initiative Grant Fund financial statement, I count $280,000 less in revenue, only $150,000 less in expenses, but no change in the fund balance. I don't think that's physically possible.
I'll check that.
Okay, thank you, Deb.
Any other questions at this time? All right, motion to place on file? So moved, Chris.
Second.
Second, John. All in favor? Aye. Opposed? Motion carries. Thank you, Peter,
Thank you all.
and thank all of you. All right, let's move on to Children's Advocacy Center. Uh-oh. Push the button on the microphone and pull it over to you so we can hear you clearly. Thank you.
Testing, 1, 2, 3.
All right, go right ahead.
Should I go ahead?
I want to move forward. Okay, thanks. Go ahead, please.
Hi, my name is Adelaide Amy. I'm Executive Director of the Children's Advocacy Center. You're probably all aware that our center is the first point of contact for children and youth who've been sexually abused, and we're the only agency in Champaign County who serves these children and families in crisis. We'd like to thank you for starting the center and continuing to support it. You're probably all aware that there are not direct tax dollars, that we are talking about a spending authority here. So all of the cash that comes in are from grants and gifts and donations. So I wanted to point out our numbers are relatively flat from last year. There are a couple of changes. One is that the gift that we got from the University of Illinois, which is funded by sanctions against Penn State, that the amount we're getting, which we'll get next week, is $10,000 more than last year. So that's going to be very beneficial to the center. The money only comes 1 year at a time, so we have no promise for the future. Also, because this is a spending authority, Deb and I talked about just having the numbers, like adding $20,000 in both the expenditures and revenue. So if I get a grant that I don't know about, then we don't have to come with a budget amendment. If we don't get the money, we don't spend it. We only spend the dollars that are already in the bank account, basically. So that's about all for us, and I'll take any questions.
Any questions? Okay. Place on file? So moved. Stan, second, Geraldo. All in favor? Aye. Opposed? Motion carries.
Thank you.
All right, animal control.
Good evening. I'm Stephanie Jost, Director of Champaign County Animal Control, and I don't know where to begin, but let's just start, I guess, from where we start every year. So our department is funded by the registration of animal, dogs and cats in Champaign County. We also receive revenue from intergovernmental agreements with 21 villages, the city of Champaign and the city of Urbana. We unfortunately don't get a lot of grants or donations, but we did receive, I think, $500 last year. So we did see a slight increase in revenue from the registration increase that we enacted in 2014. So we did see a little bit of an increase in revenue from there. There is a slight increase, a 3% increase in revenue from the intergovernmental agreement with the city of Champaign. But at this point, the other intergovernmental agreements have not been renegotiated. So we are planning on working on that for fiscal year 2015, where we'll see revenues for fiscal year 2016. We did see an increase. We did have two major increases in the budget. The MetCAD cost did go up from $15,000 to $17,600. And then we did budget for overtime for our animal control officers for fiscal year 2015 so that we can try to cut back on the comp time and the time off that the officers receive for being on call and answering calls overtime. So there is a $9,314 increase in overtime so that we can hopefully better manage the time and provide the type of service that Champaign County Animal Control wants to provide to the cities. I don't foresee any major purchases for fiscal year 2015. Our vans should be good. All of our medical equipment is updated and up to par, so I don't see any huge capital expenses here in the next fiscal year.
Questions? Geraldo.
Page 38, overtime, it seems like you're projecting a lot more overtime for 2015.
Right. We have never budgeted for overtime for the animal control officers. We've always given them comp time for any time that they've worked over. But based on the number of hours that they worked in fiscal year 2013, that is the cost that it would be to pay them overtime versus giving them comp time. So that's the increase there.
Okay, did you change your operation hours, weekly hours?
We have not, no.
There was some talk about perhaps closing one day during the week so you could allow all day Saturday, where people would be more available to
Right.
work with you.
Well, what I had proposed was closing the office on Saturdays, but not closing the service. So there would still be animal control services 7 days a week, but the office, the administrative office, would only be open Monday through Friday. But at this point, we're still kind of working on a plan for that and seeing what the true cost savings would be for that.
Okay, thank you.
Mm-hmm.
Chris? Oh, I'm sorry, Stan hasn't said anything yet tonight.
I've always, when I look at your budget, Stephanie, capital improvement items, and I heard you mention your vans and that, but there's really no money in there, and you're projecting a fund balance in the negative, which you're hoping not to. But as we all know, and I see you have some money in there for maintenance of the vehicles and that, but not only that, you've got equipment over there that could fail at any time. I mean, we've talked about some of that, and it worries me a little bit that your budget's really, really thin.
Mm-hmm.
And I don't know, and then you're adding overtime, which I know that happens, versus comp time and that. But I just, you've been going at this now, and that's been one of the major concerns that's been raised. I know Al Nudo raised it, I've raised it. It worries me about our buildings and everything else, but particularly with your budget, I mean, one of those vans could the engine could blow up, anything could happen. And
You're right.
You've got no leeway there.
And I think that's why we need to really I need to really focus this year on what the true cost of animal control services is. We've always been just charging what we charged when we started. We really haven't increased the prices or the costs that much to really accommodate those capital expenses that will be coming in the future. So I have really been focusing the last 2 months on developing what capital expenditures would be to replace the cages, the vehicles, the ventilation system, the roof. I didn't realize how time-consuming that is, but I'm about halfway done with that, so I hope to have a plan in place for 2016 so that we can start charging the cities and villages the appropriate amount with those costs factored in, so that we can perhaps save some money. At this point, we've just been operating day to day and only charging what our true costs are to operate it day to day. And I have realized that we need to start planning for future. The building is, obviously quite a bit older than the program itself. So it's one of those things where we need to start planning for future cost. And I recognize that, and I'm kind of, I guess, soft in that, I hate to charge Longview the same cost that I charge the city of Champaign because they're not using the facility, and but it isn't fair to charge the city of Champaign $55 and in the village of Longview $39. So I have to work through that, and that's part of why I haven't really addressed that issue until now.
I know we've raised fees, on some of the tags and other things, and I was sort of in hopes that I saw where you had budgeted before 4,000 or a little over 4,000 for capital and equipment. Now that's gone. But hearing you talk, and no difference to you, but we've talked about this before, and there's still no plan. There's still no 5-year outlay of, okay, what about the roof? And when I hear this, being on facilities now, I just sort of pull my hair because I think you can't keep kicking that can down the road. So hopefully next year, I won't be here, but I hope some that are here hold your feet to the fire, because without them, you're the one that knows. You're the one sitting in that building. You know if that roof leaks. You know if that heating system's working right. And you're not talking little dollars. You're talking a big outlay at once. And I'd hate to see the homeowner get hit with another $2 to, have a CAD, or $3, whatever. And as far as your fees, I think, like the Board of Health, you need to look at, when you're talking overtime and that, where's your most calls? What is that actually costing you to go pick up a dog? Are we coming back? Are we losing money? Because it sounds like to me, based on what I'm looking here, there really needs to be some number crunching. Really needs to happen. So I hope you do, but I won't be here. But I know that building's going to need some stuff, and it isn't 2 years down the road.
Chris?
I was just going to say, I basically agree with Stan's saying, in that we need to account for the cost of capital replacement and services we provide. On the other hand, I don't exactly feel like I have the moral high ground here, given that, Stephanie came to us 6 months ago with a cost control proposal, and we turned her down. So, to some extent, we can talk about holding feet to the fire, but a lot of this is our feet. If there's a structural issue here in terms of how much we're taking in fees and how much we're providing in terms of services, Stephanie can do all she wants, but it's going to come down to the county board to either have the will to dedicate more money to this, or, take the hit of going out to the cities and saying, you're going to have to pay more.
Any other? Yeah.
There's just two things I want to add. Stephanie and I did talk about adding the overtime, and most of the overtime is spent in the city of Champaign. So we really have to pay it in order to be able to really say to the city of Champaign, this is a true cost. When we keep trying to cover it with time off, and we only have 3 wardens for 24/7, right? So there's that. The other thing is, we have to give the city of Champaign and the other villages and cities plenty of heads up. So our goal is to be able to tell them what our real costs are this fall, which is too late for our budget, but in plenty of time, giving them 6 months to plan for it before they're in their next budget planning cycle. Because we've been turned down when we've asked for larger increases to them because they said it's too late in our budget process, we can't possibly do that. So our goal is to make sure that by October, everyone knows what our true costs are so that they know what to expect with the next renewal of their contracts next July 1st.
Chris?
If I could follow up, I would just say that when we do that, we need to sort of draw on what Stan said. If we've in effect been running this program at a loss for years, we need to factor that into what we're trying to charge them and hopefully get some makeup out of that, because obviously, we don't have a capital replacement reserve for this program, and that's because we've been giving the cities too good a deal and spending our own, spending down our facilities, as it were, to keep their rates low. So, yeah, we need to, we don't just look going forward, look at the hole we're in to start with.
Well, I think we'll look at the hole we're in with capital as from the perspective of what we would have to have today to replace the things that we have coming in a timely manner.
Good. James?
Yeah. I want to thank you, Deb, for getting involved with this because an operation like this is small enough, there's no room in this org chart for business analyst. And that's the kind of work we're talking about here. I know it's hard, and Stephanie, sounds like you've been going through this, trying to put this together. Pro formas is, for some folks who do it a lot of the time, it's not too bad. But if you only do it, once in a while or haven't done a lot of it, it's a hard thing to do. So I think, we as the county board have to recognize that in some of these smaller operations, we have to lend the expertise of the county financially to move some of these things forward, not just keep looking at those small groups and saying, figure it out, okay? Thanks, Deb. Thanks, Stephanie.
John?
Thank you.
And this is kind of an information kind of question I'm going to throw out. And it's on the capital side of expenses. And it's like kind of what James was going to bounce off what he said about buildings and vehicles, because you're small enough, but you're one of the facilities that has vehicles that you definitely depend on. And with that in reference, are your vehicles serviced over at the highway building, or do you go someplace with your vehicles to service?
We use the highway garage. However, we have a van that was a victim of a hit and run, so we're taking it to an outside body shop for that type of work. But we do use the county highway garage 99% of the time. It would only be for something that they can't, they don't have the equipment to handle.
Right, maintenance and maybe some minor repairs?
Yeah,
Probably.
like any kind of oil change, any tires, any of that type of thing.
Right, and the sheriff's department does the same, correct?
Yeah, all the county vehicles at this point are maintained at highway.
And I'm assuming too that since we're putting together with our new director, kind of a catalog, and this building will be part of it for maintenance, future maintenance, and current repairs and everything else. So it'll be within, the confines of this county board too, to make sure that we've got the money to keep these facilities up on the outside and the inside too. So make that point too. Thank you.
Thanks, John. Any other questions? Okay, motion to place on file, please. So moved by James, second by Max. All in favor? Aye. Opposed? Motion carries. Thank you.
Thank you.
And finally, Mr. Jeff Blue from Highway. Last but not least. Good evening, Jeff.
Good evening. Stephanie does bring all of her vehicles to us, and we recognize the plight that she's in, and we actually do try to help her out and try to do things kind of pro bono from time to time to make sure her vehicle stays on the road without breaking her budget. So I just kind of wanted to lend that in. We do that. So we'll start out here. I think, Deb, what you gave me is the same page numbers they have. Is that correct? Yeah, okay. So starting on page 49 there is just kind of a synopsis of all the different funds that we at the Highway Department utilize in order to maintain the roadways. We have roughly 200 miles of roads and 87 bridges. As you know, I'm also kind of the engineer per se over a lot of the township stuff when they come in and need projects done on their 1,559 miles and 610 bridges. We help them out as well. But we have the highway fund, the bridge fund, and the federal aid matching tax that comes directly from the county levies. And then we have the county motor fuel tax fund, that comes from the state's motor fuel tax, and then we also have the federal aid funds for bridges and highways that we get from the federal motor fuel tax fund. So those are the different funds that we have to pull from when we're doing projects. Page 51 just kind of gives you a brief outline of the township road districts, and we do have a township bridge program, which is another funded program through the state where we receive monies to replace bridges on the township road system, where we can use that at an 80%, and we match it with 10%, and the townships match it with 10% as far as replacing township bridges. You see there on the township bridge fund, we get about $325,000 a year as of right now, and obviously the townships get motor fuel tax funds and also have their own levy authority as well. Page 52 just gives you a quick look at the mileage on the different townships and their road systems versus their valuation. I'll note that the 1,528 miles of township roads is the third largest township road system in the state of Illinois, behind Livingston and Iroquois counties just to our north. So we do have a very large township road system. Starting with the County Highway Fund on page 53, you'll see there that we have 20 full-time employees at the county between maintenance and engineering and staff up front doing our cost accounting and so forth. Property tax is slated at $2,247,000 this year. Some of our other revenue streams that you'll see there underneath the highway fund, we do transfer quite a bit of money from the county motor fuel tax fund into the highway fund to help supplement the highway fund. $225,000 is transferred via equipment use, that we basically rent our equipment from the highway fund to the motor fuel tax fund and pay for that. And we also do get some money back for doing engineering on county and township projects from the motor fuel tax fund as well. And then a revenue source there that you see kind of down at the bottom of our revenues from general corp fund that is actually to pay for one of the mechanics that we have on staff. We have two. Highway pays for one, and general corp pays for the other in order to maintain all the vehicles underneath the general corp budget. In our expenses, you'll see obviously our major expenses coming out of the highway fund are our personnel funds, $1.7 million. So that leaves basically about $1 million left in order to take care of everything else outside of personnel. Major expenses that we use the remaining $1 million on are gasoline and oil. You know, those big trucks get about 5 to 6 miles per gallon when we're on the road, so they're constantly needing fuel. Road and heavy equipment maintenance, about $160,000 there to maintain our equipment in our own shop. That just pays for parts and the things that we need in order to maintain our heavy equipment. And then heavy equipment capital purchases this year is slated at $277,000. And if you kind of jump back to page 58, that's a listing of the vehicles and the equipment that we currently have at the County Highway Department. That $277,000 for budget year 2015 is slated to purchase a new dump truck. Those run about $160,000 to $165,000 fully equipped. We're going to be replacing Unit 23, which is a 2003, so that'll be 12 years old when it gets replaced. Our mowers are older than dirt, and they're falling apart, and we're putting more money into them than they're worth, so we're looking at replacing 2 mowers, not the physical tractors, but the mowers that we pull behind the tractors. Those are $15,000 to $20,000 each. And our mechanics truck, actually when we purchased the mechanics truck back before I was even here, back in 2001. It was just purchased as kind of a general service vehicle. We didn't have a mechanic at that time. We didn't actually have a full-time mechanic on staff until around 2005. So it's getting antiquated. It's two-wheel drive, which makes it very difficult to take out in the wintertime when we have breakdowns out on the highway when we're pushing snow. So we're going to look at replacing that, keeping that vehicle for other uses in the highway department, but replacing that with a four-wheel drive service truck that we can take out on the roads in inclement weather during the winter times to take care of our vehicles. We have a couple more years left there for the highway facility bond. That's slated at $106,000 this year, so 2 more years we'll have the highway department building paid off. So that'll be a good feeling to get that paid off. So you'll see our fund balance. We have a totally revenue versus expense, 0 change in fund balance from 2014 to 2015. We look at our performance indicators back on page 57. And we try to look at those based on, you know, the number of projects that we can design and construct and actually what those projects cost us based on the percent of the design, which basically means our engineering estimate versus the actual cost of the projects. And then look at what the project cost us as a percent of the award, which means if we bid a project comes in at $1 million, is it going to cost us $1 million? Is it going to cost us $990,000 or $1 million and a couple of bucks? So those are performance indicators looking pretty good there. Going on down into our performance indicators for our roadways, you'll see we do about 50 miles roughly a year of ditch grading and shoulder repair. Our PCI, which comes from our pavement management system, is holding steady from year to year. We like to keep it above 70 without a doubt. We do show a 86% of our roads with a PCI greater than 60, and I think we're actually starting to gain on that with our cold in place recycling projects that we're doing now. We're getting longer lasting pavement, and the PCI ratings are actually staying higher over a longer period of time, and it's kind of like rebuilding a road without paying the enormous amount of money of actually going down and starting back in the road bed and rebuilding the road. So move on from the highway fund then into the county bridge fund. See revenues there of $1,138,000 this year. This is the fund that we use in order to help the townships build their bridges as well as build the bridges on the county road system. Excuse me. This is a tough one to budget for because bridges oftentimes start in one year, end in another year. We pay for them sometimes in one year, and then they get held over. Sometimes we don't get final payments out because we don't get the materials certified from IDOT. So, I mean, you can see looking at the actual expenditures, 2013, 2014, the projected in 2014 and the budget in 15, they vary all over the place. We're still maintaining a pretty good fund balance of $1.8 million, but like I said, it's kind of hard to predict when those bridges are actually going to get built, when we're going to end up paying for them from year to year. But it's just kind of a fluid program, and we continue to take candidates from townships, continue to help them on their projects, and we'll continue to use the money that is left over that the townships don't use from year to year in order to build bridges on the county highway system. And actually, we, I think, are one of the only counties south of I-80 that don't have a posted bridge on our system, which I think is a pretty big deal. I mean, we don't have any bridge that somebody can't drive across legally loaded with a vehicle. And you look at some counties, there's a number of closed bridges, there's a number of posted bridges, and we're very, very lucky to be able to say that we don't have any posted or closed bridges. You know, we do bridge inspections every other year. So we're doing about 600 bridge inspections every other year. That's 300 a year with our engineering staff. They do a marvelous job of keeping up on the bridge conditions, and we try to get out there and take care of them before they get to the, to the point where they need to be closed, that they need to be load posted. You'll see there are performance indicators, again, kind of all over the place as far as designed and inspected and constructed. We do a really good job, I think, of keeping our costs in check with what we do as far as our bids. And the Highway Committee will see those over the years, and they're brought to the county board, the number of bids that we get on the projects, and they're always pretty darn close to what we're estimating. And typically on a bridge project, we come in real close to the actual awarded cost, because there's just not that many things that, that can bust a bridge project fund. The next page, 64, you might need a microscope or, some kind of magnifying glass to read that. But that's just basically a synopsis of all the bridge projects that we've done from 2012, and then the projects that we see coming ahead into the future of 2015 through 2017. It's hard to project the township bridge projects because we never know when a township is actually going to have the money in order to match, the portion of the project which they need to match. So we rely on the townships to come to us with projects unless there's an actual bridge that we see is in the shape where we actually need to do something immediately so that it doesn't have any safety repercussions on the traveling public. Motor fuel tax funds, moving on to page 66. Projected again at about $2.8 million. There was some capital money, $100 million this year, that came at the very last day of the legislature being in session, which helps keep that motor fuel tax fund at that $2.8 million. As you know, the Illinois Jobs Now had a 5-year payout, $500 million, so it's $100 million a year into the motor fuel tax fund. But that's going to end this year. It's 5th year, and we're going to see in 2015, and actually that money might come in 2014, we're hearing now, is the $100 million from the capital bill that was approved this year. Basically, our motor fuel tax fund is used to fund maintenance and construction of the roadways. You'll see that our budget in 2015 is pretty significant, as well as the monies that we spent in 2014. We completed a couple of major projects this year with the Thomasboro Road and the Hensley Road. And as you know, the whole salt thing and everything that came through in the budget amendment that was at the last meeting. That's why you're seeing that projected budget in 2014 at $2,950,000. The $2,900,000 and the road improvements, which includes right-of-way and road improvements, is all going towards the Dewey Fisher Road next year. That project is estimated at this time to be about $7.7 million. That's a huge project for us. We've got 5 different funding sources. We got federal money weighing in at about $4 million. We got the federal aid match fund coming in at $400,000. We've got truck access route program funds at $900,000, and then we've got the MFT funding coming in to fill the balance of that. So we're diligently working towards trying to secure all the right-of-way on that project. The plans are 95% complete, and we're out beating the pavement and knocking on doors and making phone calls every day, trying to get the right-of-way so that we can go ahead and move forward with that project next year. It's going to be a great project. That's the highest trafficked road in the county, like 15,000 vehicles a day. So to get those added shoulders and get the safety ditches and get it repaved will be a significant improvement to our transportation system. That's about 5 to 6% of our transportation system on that road alone, just as a percentage of total miles. You'll see the motor fuel tax fund source distribution and uses. That's just a packet that comes from Illinois Department of Transportation there, starting on page 69 and going to page 79. It just kind of gives you an idea of where those funds come from, who they go to, and what piece of the pie the counties and townships actually get in order to rebuild and take care of our roadways on a year-to-year basis. Page 80, the Federal Aid Matching Fund. We reinstituted in 2014 a levy for that, which is great because it will help us kind of leverage more federal funds. You'll see $400,000, as I mentioned, coming from that fund this year to go to the Dewey Fisher Road project in order to be, a partial source for the construction dollars on that project. So those are kind of the highlights of my budget. And I'll take any questions that you might have.
All right, let's start with John.
Jeff, when you get done with Dewey Fisher, is the next big project going to be with the MFT funds? Going
What's
to be
the next
Lincoln
one?
Avenue? Is that going to be our next biggest project?
Our next project for county roads is the Dewey Elliott Road. But Lincoln Avenue, we have $1.1 million in an agreement with Urbana in 2015, or 2016, excuse me. Yes, yeah.
Around it.
Yes, Jeff. First of all, I would like to acknowledge and congratulate you on your distinguished award. And it's
Thank
so
you.
intimidating that I don't know if I should ask you any questions pertaining to your expertise. But I do acknowledge that, and I think that we should be very grateful that you have stayed with us and that you're here to work with us and do such distinguished work. The question I have is, what do you do with your retired vehicles after the use?
Actually, we just had a conversation about this today. Facilities is looking for a couple of vehicles, so we may be transferring a couple of our retired pickup trucks or utility vehicles to facilities. The other vehicles are like when we get a dump truck that's getting older, we'll offer it to the townships. Highly unlikely that they'll take it. Otherwise, it goes on eBay, and we end up selling it kind of in a public auction through eBay. Last time we sold a truck, I think somebody came all the way from like Maryland and bought it and took it back. So, yeah, those get offered for public auction.
Okay, great. That's all I have.
Any other questions? I wanted to, Patsy, go ahead.
Hey.
Okay, these are just mostly clarification questions. I'm looking at, I'm on page 55
Okay.
for your reference point, and I'm looking at line 54433.
Yep.
No, I'm sorry, 35,
Okay.
where it says heavy equipment, and that's the 277 or 278,000.
Right.
And then under that is capital for another 304,000.
Well, that's the total of those.
All of these together?
Yes,
Okay.
yes.
So I'd like to focus on the heavy equipment.
Mhm.
Is that equipment that you put bids out for, or is this equipment that you buy as secondhand and you don't have to bid for that type of equipment?
Well, the majority of the equipment is purchased off of the state contract because the state does the bidding for the large trucks, and we will buy it off a state contract. We did buy one truck last year from another county because we had two of them go down in a very short time frame. And in order to purchase a truck from the state purchasing contract, it literally takes us about 6 months to get it. Because from the time we order it, then it goes to typically International is who gets the contract. They have to make the truck, has to be shipped to Illinois, then it has to go to an outfitter to put the dump body and the plows and all that on it. And by the time we get it, it's literally about 6 months after we've ordered it.
Wow.
So it is quite a lengthy process in order to get that done.
It is.
Yes.
Thanks for that explanation. Okay, can I look at line 53476? And, no, that's not what I want to look at, sorry. I want to look at 53349, heavy equipment of maintenance.
Yes.
Is that just sort of your in-house charges for maintaining your own equipment, or are you outsourcing this?
The only things we outsource would be things that our guys aren't capable of handling, which is very, very few things. This is mostly for parts.
Oh, this is a part
Yeah,
situation.
there's no labor in there unless we have to
Okay.
go out to an outside vendor in order to have some labor done.
Okay. All right. Thank you very much.
Any other questions? John?
Jeff, we've all been a little concerned about the motor fuel tax and where it's headed. Give us your scenario.
I think we've talked about that here in the last few months at Highway, and it probably brought to the full board as well. But, looking about 2 or 3 years down the road, you can see our fund balance now is getting close to, about $1 million. So 2 or 3 years down the road, we're hand to mouth at best in the motor fuel tax fund, unless something drastic happens at the state where, they start finding a different way to fund the motor fuel tax. It's going to be tough, and it's going to be hand to mouth. And we all know that, we've got some of these fringe projects that we are still sitting out there that haven't been funded yet, that are going to come and raise their weary heads someday. So we're going to have to be careful when we're looking at those projects. But our PCI, our road condition index, is in pretty good shape right now. And I think with the maintenance that we're doing a lot of crack sealing, we're doing a lot of seal coating. We used to get 12, maybe 15 years out of a road. Now we're getting more like 20 years out of a road. So we're being able to extend the life of our pavements. We're being more ingenuitive in the way we rebuild our pavements. But it's going to get to the point, in like 3 to 4 years, where it's going to be, any cost overruns, any projects that we didn't foresee are going to be really, really tough for us to be able to fund.
Well, then, my favorite thing that you participate in is the Fringe Road Agreement.
I participate in it?
Against my better judgment most of the time, but where do we stand on them?
Well, we've got the Lincoln Avenue project, which we've already set aside the $1.1 million. Looking into the future, the obligations that I'm aware of that I've found in documents in places would include Curtis Road going over to First Street. That's going to be a huge project at some point with the village of Savoy, because there's a overpass over the railroad, and rebuilding that road over to First Street. There's a commitment on Prospect Avenue going up to Olympian Drive, the kind of the seal coat, the old asphalt section that I'm aware of. And those are the two that I can think of off the top of my head that we have commitments somewhere in documentation.
Any chances of destroying that documentation?
Thank you. Geraldo.
Yes, I had an additional question, and it was sort of along the lines what John was indicating. Page 54, lines 335, 60. Did we collect all the federal and state and intergovernmental agreement funding for Olympia Drive? Is there a line here for that?
No, that's not in our budget. That project is being headed up by the city of Urbana. There's no money coming from our budget at all into the Olympian Drive project. I guess I say that we have one engineer out there overseeing the project. We're paying for his time, but then we're getting reimbursed for it. So that's a net zero as far as cost to us. And the entire project is being funded through the Grade Crossing Protection Fund, federal aid funding, and Illinois Jobs Now, with no money coming from our budget at all.
Oh, okay, great. Sounds good.
Any other questions? Jim?
I've checked Google about 5 times, Mr. State Engineer, and I can't find ingenuitive anywhere.
You're not looking on the right Wikipedia page.
Chris?
Thanks. I was just going to point out, I mean, with regard to the motor fuel tax, I mean, I think there's definitely cause for concern. The current system is unsustainable. I would also make the point, though, that there's 101 other counties in the state, all of whom are facing the same problem. And the fact is that the stellar leadership of this great state of Illinois has not changed the motor fuel tax rate. I mean, it's not a percentage of the fixed cost per gallon. That hasn't changed in 25 years. And in that time, cars' fuel economy have gotten a lot better. So essentially, the rate hasn't gone up and the amount they're collecting has gone down with the improvement in mileage of vehicles. So at some point, you know, we're going to have to hold Springfield to the answer. We have to expect Springfield to answer the question, you know, we're tax capped. You're essentially decreasing our motor fuel tax revenue every year by design. What do you expect us to do to maintain county highways? And I mean, that's a question that all counties are going to be facing. So I would expect to see some change in the funding model there at some point.
And you factor into that, I mean, how much construction costs have escalated in the last 10 years. Oil in particular, I mean, that's one of our base for asphalt, obviously. So, yeah, we're heading in the wrong
I mean,
direction.
it's nice to be the state and be able to wedge the counties into a corner, but at some point, you know, people are gonna figure out where the problem is.
Well, that's about it. I do want to thank you, Jeff, for working with me on that District 5 funding for projects that we never had, but you really helped me in convincing IDOT to give us some projects down here on District 5, so.
We got a few.
Yeah, we
Hopefully
got-
that interchange comes to fruition.
It went from 0 to a few, which was better than none. So I want to thank you on that score, and again, reiterate that we do congratulate you for your award. You have certainly deserved it. Do I have any other questions? Oh, Max. What's that? I'm sorry. Well, I haven't made that motion yet. I'm about to. Thanks, Max. I appreciate. You got something else to say, Jim? Okay, second by Jim. All in favor? Aye. Opposed? Motion carries. Motion to adjourn. So moved. Second. Aaron, finally, got you to wake up there, Aaron. All right, all in favor. See you, Aaron, tomorrow night, 6 PM.
close it again
And
to
by the
see
way, it's the same book. You have the same book. Oh, it's a different book, Wednesday's book. This is Wednesday's book. Don't throw this one away.